Welcome to The Explainer. Today, we're going to break down a fundamental nursing skill you'll see time and time again, removing an NG or NI tube.
So, if you're a nursing student trying to lock in these key clinical skills, not just for your exams, but for real life on the floor, you've come to the perfect spot. We're about to walk through this essential procedure step by step. And hey, if you find this helpful, make sure you subscribe for more nursing explainers just like this one. Here's our game plan. We'll walk through this in 6 clear sections, starting with the prep work and going all the way to the critical points you absolutely have to know for your exams.
First things first, let's quickly touch on the why. Why do patients have these tubes in the first place? And what are the stakes when it comes to taking them out correctly?
Yeah, so these tubes are absolute workhorses, right? They're used for decompressing the stomach, giving meds, providing nutrition, you name it. But once their job is done and the provider writes that order for removal, it's on us, the nurses, to get it out safely. And that's a huge responsibility.
Now, what's really fascinating about this skill is how much of the critical work happens before you even touch the tube. Honestly, proper preparation is everything.
Your very first move, always, is to dive into that chart. You have got to verify the provider's prescription for removal. No order, no removal. Simple as that. While you're in there, you're also playing detective, checking for allergies, like latex, reviewing their medical history, and noting anything that might complicate things. Okay, charts reviewed. Now, you get your supplies together and focus on your patient. This means grabbing all your equipment, pulling that curtain for privacy, introducing yourself, washing your hands, and of course, confirming you've got the right patient with 2 identifiers. You're basically setting the stage and building trust.
And this right here is a perfect illustration of a key part of that prep, patient education. You have to tell them, hey, this might feel a little weird in your throat, and I'm going to need you to hold your breath for just a second. Explaining that ahead of time, it totally lowers their anxiety and makes them a partner in the process, which is exactly what you want.
All right, with our prep work done, let's move into the procedure itself. You'll see how each step we just took builds towards a safe and really smooth removal. First things first, positioning. This is your #1 defense against aspiration, so it's a huge deal. You want to get your client sitting up nice and high in a high Fowler's position. Think at least 30 to 45 degrees if they can handle it. Then, drape a towel over their chest, offer some tissues just in case, and pop on your clean gloves. So before you pull the tube, you have to disconnect it from everything. Disconnect it from suction or the feeding pump, because you don't want any of that stuff draining back into their lungs. Then you'll unpin it from their gown and gently remove the tape from their nose. All of this just clears the runway for a smooth exit. Almost there. Next up, you're going to flush the tube with a little bit of water, saline, or even just a puff of air. This just clears out any gunk that's left inside. And immediately after you flush, you're going to clamp it or pinch it shut right near their nose. That way nothing leaks out as you're removing it. Okay, I really want you to focus on this next part. This action is one of the single most important safety measures in the entire procedure. It's all about preventing aspiration. So here it is, the crucial instruction. You're going to ask the client to take a nice, deep breath in and hold it. Why? Well, when they hold their breath, their epiglottis automatically closes over their windpipe. It's like a natural barrier that protects their airway from anything accidentally getting in there. It's so important.
So while they're holding that breath, you'll use your dominant hand to pull the tube out in one smooth, steady motion. It's not a race, but you don't want to hesitate either. As you pull, you use your other hand to collect the tube in a towel, keeping everything nice and tidy.
Fantastic, the tube is out. But wait, your job isn't over yet. Now your responsibilities shift to assessment, providing some much-needed patient comfort, and of course, proper documentation. So what are your immediate priorities? First, inspect the tube to make sure the tip is intact. You need to confirm no part was left behind. Then you'll measure any drainage, dispose of all your materials properly, and provide some comfort care, like nasal and oral hygiene. Trust me, they'll really appreciate that.
Clinical practice isn't always by the book, so let's quickly cover what to do if you run into a potential complication.
This is a big critical thinking moment.
You're pulling the tube smoothly, everything's going great, and then, suddenly, you feel resistance. What should you do?
The answer is simple and absolute. STOP. Never, ever force it. Forcing the tube could cause serious trauma. Stop the procedure immediately, make the patient comfortable, and notify the provider for further instructions.
All right, let's distill this whole thing down to the absolute essentials. These are the points you need to have locked in both for your exams and for safe practice.
If you remember nothing else, remember these 6 points. Verify the order. Position the client upright. Instruct them to hold their breath. Stop if you feel resistance. Check that tube tip. And document everything. Nailing these is absolutely crucial for the NCLEX and for patient safety.
Hey, if you found this format helpful and want more condensed study materials, I put links to some fantastic NCLEX revision guides down in the description. They cover all your nursing courses and are a great resource for studying.
And that is a wrap on NG tube removal. If this explainer helped you out, do me a favor and hit that like button, share it with a classmate who might need it, and subscribe for more. And definitely let us know in the comments what other nursing skills you'd like to see us break down.